It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, Hoosier patients are testing a new app that uses the Apple Watch to help them prepare for and recover from hip and knee replacements. Warsaw-based Zimmer Biomet partnered with Apple to create the mymobility app. And Business of Health reporter Kylie Valletta shows us why surgeons and developers believe it could revolutionize how patients recover from two of the most common surgeries in the country. Kylie.
Thank you, Gary. Traditionally, a patient would go for physical therapy sessions after a knee or hip replacement, but the app replaces that process using the power of technology. Zimmer Biomet has launched one of the biggest enrollment studies in the history of orthopedics to test the app's use compared to conventional recovery methods. Here to tell us how this could change tomorrow's standard of care is Vice President of Connected Health Strategy, Ted Spooner, and Dr. Wesley Lackey, an orthopedic surgeon at the Midwest Center for Joint Replacement in Indianapolis. Thank you both for coming to the show.
Thank you.
Ted, let's start with you. I think with looking at this app, it does impact the pre-op process, but most people really notice the changes it makes to the post-op process. Tell us, what does post-op look like now using this app and the watch?
So you can imagine that there's a lot of anxiety for patients, as they go through the process of getting ready for surgery and then have surgery. And one of the biggest ways to reduce their anxiety is make sure they know what to do. The watch is something that they can wear every day that gives them a list of things to do every day that's been prescribed by their surgeon. And then as they check those list items off, the surgeon is reported and the care team is reported about the patient's progress. So it really helps keep them on track. And I think more than anything else, it helps them feel that they're informed about what they need to do and the progress that they're making themselves and where they need to go, tomorrow and next week.
And as far as the movement it tracks, steps, stairs, how much time you're spending sitting, how much time you're standing.
Right. Those are all measures of mobility, right? And, every day you probably take for granted that you get up out of bed and, walk in the kitchen and make yourself breakfast. But every time you do that, you're obviously exercising big parts of certainly your lower extremities, but your whole body and your heart. And this is a way for the doc to really see that that's happening, that functional behavior that the patient wants to return to and obviously wants to return to without pain is something that the doc can track, and this is a way for them to do that.
So Dr. Lackey, your clinic already has patients in this study. You're looking to enroll hundreds more. What are the benefits, both sides of the equation? He touched on some of them for the patients, but also for the surgeon and the surgical team.
Yeah, we definitely think it's going to be a win-win. At MCJR, our goal has been to take the pain out of joint replacement for everybody involved, and that's from the first phone call to the ease of scheduling an appointment to outpatient surgery, partial knee replacement, and it goes on and on. The patients have their surgeon's cell phone number in our practice, but there's still, like he said, a bit of anxiety. The patient, most of the time in their experience, is at home on their own, and they don't know what is normal and what's not. And so we think that having this connectedness between patients and their surgical care team is really going to make them feel more comfortable and more confident. From the surgeon's side, having this surveillance on all our patients that when they're not with us is going to be a huge game changer for us to know who's doing well and who we need to contact and help out along the way.
So this takes work typically done by a physical therapist, and it seems like it shifts that to the surgeon and the surgical team and really the patient. So what are there any risks or challenges associated with that?
There are definitely some challenges as we kind of change, the transition of care. Currently, physical therapists do work with all of our patients, but it's mostly around the time of surgery. And a lot of the exercises post-op are fairly straightforward, and patients are doing them on their own anyways. And so this app has, they can do it along with the therapist, and we'll still, again, be able to survey our patients and know who's struggling. And those are the patients that will need that extra help from a therapist.
And Ted, we have just a few seconds left.
Sure.
Tech is penetrating every aspect of the medical industry. Is this going to be the new way to recover using these wearables?
It's not just orthopedics, but orthopedics is especially applicable to this kind of technology. Measuring movement and measuring the kind of functional way that we operate every day, and doing that on a consumer wearable that also is a health measuring device. Means orthopedics is a really great place for us to deploy this. I think you'll see it more than knee and hip soon as we take it into other categories. But certainly the study is, groundbreaking in the way that we see patients and work with docs for their care.
Well, thank you both for being here, and good luck with the study.
Thank you.